All right, we are streaming live on Facebook.
Okay, great.
Well, hello and welcome everyone. This is HeartMind Happy Hour, and I'm your host, Holly Copeland. I am a human potential coach and a scientist, and I do these conversations because I love to bring people who are wise in topics that I coach around and I'm very interested in personally, on consciousness, meditation, and biofeedback and biohacking, and also health and wellness. And so today I'm very, very excited because we have a health and wellness expert, Dr. Michael Smith, who is here. He graduated from Bastyr University Medical School, and he's a licensed naturopathic physician in the state of Washington and a board certified biofeedback specialist from the Biofeedback Certification International Alliance. And he is going to talk to us today about self-mastery or self-regulation mastery. And I had an initial conversation with him last week, and he is incredibly knowledgeable. So I am super excited to bring him to this audience today to share his knowledge on all of these topics. So welcome, Dr. Smith.
Thank you. Thank you very much. I'm super excited too.
Great. Well, really appreciate you taking the time to, I know you have a very busy schedule and taking the time to talk to this audience.
Yeah, absolutely.
Well, welcome. Well, just like to start by, I'm really interested in this topic and to hear what you have to say about self-regulation mastery and really what that means. But before we dive into that, just can you describe a little bit about your background and how you got into doing this work?
Sure. I was an athlete my whole young life and young adult life, and wrestling was my sport. So I was good enough. That got me a scholarship to a Division I school. And while I was there, I was pre-med, and around that time, I was trying to figure out what I was going to do, if I was going to be a physician assistant, if I was going to be a physician, if I was going to be a physician, what kind of physician. And so after graduating undergrad, I started working at a hospital just to get some experience and see what it was like, and start to shadow some docs and get an idea for their work and what they were doing and their struggles and their challenges and all those things. And so as I was a patient care tech, so I was like a nursing assistant basically on an orthopedic floor. And orthopedics really interested me at the time. So orthopedics and neurology. But while I was there, I got that firsthand education on what conventional medicine actually is. And it was a rude awakening for me because I didn't really know that about conventional medicine, I guess. And so it was just docs, unfortunately, not taking the time, and a lot of prescribing one thing after the other and giving this thing for this side effect and this thing for that side effect. And the one thing that kind of threw me over the edge was when I was in a patient room and I was helping a patient, and it was like a 1 or 2 day post back surgery. I think it was upper cervical spine, and the doc just came in, stood in the doorway, and with the patient's chart, and asked the patient, "How you doing today?" And the patient said, "I'm doing." And the doc said, "Okay, I'll check on you tomorrow." And that was it. That was the whole communication experience of that. And I was like, wow, okay, I need to find something else. Something that resonates with me, that I'm going to be passionate about. And so doing some Googling, I came across something about naturopathic medicine. And so I started that deep dive, and I started reading about the principles of naturopathic medicine, the philosophy, and I was like, wow, this is me. This truly resonates with me. So then I applied to Bastyr, which is a very renowned naturopathic medical school, probably the best known, and probably in our naturopathic medicine circle, maybe the Harvard of naturopathic medical schools. And so I was like, if I'm going to do it, I'm going to go to the best. And so I only applied there. And I got in, and it was an amazing experience. And that's when I started to get back into to that mind-body connection, something that I'd kind of lost a little bit while I was working. But it's something that I did, kind of not knowing it, in athletics and wrestling. I would use visualization and breath work all the time, even though I didn't know that I was doing it. I didn't find that out until medical school. And so that really resonated with me. Again, mind-body medicine, and learning what biofeedback was and self-regulation. I was like, wow, this is it. This is it right here. This is how you can truly heal people, by treating the nervous system. And so, yeah, so that's a little bit of my background.
It's great. I appreciate the story and your experience, kind of how you made that transition. And I have so respected naturopathic medicine for a long time now. And my primary physician is a naturopathic doctor in the town I live in. And just really appreciate the contribution of naturopathic medicine, especially to these complex,
Yeah.
things, that the whole body medicine that, so many people are suffering from. Sure, if I'm in a car accident, I'd like to, have a broken bone fixed
Yes.
in a
Yes,
conventional
absolutely.
hospital. But
Yeah.
as I'm sure would, but I'd
Yes,
also like
absolutely.
my naturopathic doctor to be there with all the tools that she has available as well.
Yes. Yeah, 100%. Absolutely. Yeah, there's a place for all of it. There is. There truly is. There's a place for all of it. And I feel like that's where conventional medicine really shines, is in emergency medicine. But in almost everywhere else, I would say, where we should be starting, at least, is the foundations. And that's where I start with most patients, is the foundations. Start with talking about nutrition, and different therapeutic diets, or just nutrition more generally, broadly. Eating a lot of colors, and talking about therapeutic fasting when it's necessary.
Yeah.
Hydration, talking about hydration, and trying to stay away from the caffeine if possible, staying away from the carbonated beverages and all that stuff, the juices, very sugary. Movement, exercise, talking about hydrotherapy, which maybe we'll talk about a little bit here today.
Yeah.
Sleep is the biggest thing, especially when it comes to recovery of the nervous system. So talk a lot about sleep. And then supplementation. So any necessary supplementation or herbal medicine that can do the exact same thing that a pharmaceutical is doing, just a little bit gentler, not completely, stopping a pathway, but modulating it, and working with the body, so that way there's not as many side effects.
Yeah.
And then educating them on the drugs that they are on, and if they're, taking them properly, and yeah. So those are the foundational pieces that need, I think, to be met first before we start to introduce other therapies.
Yeah, absolutely. That sounds like a very foundational place to start. And your mentioning of eating the colors reminds me, I was a teenager in the 80s, and one of the books on my parents' bookshelf was a book called, I think, The Rainbow Diet. Gabriel Cousins, and it was eating for your chakras, eating all the colors.
Oh,
So
cool. That's
yeah,
awesome.
I got exposed to that when I was pretty young.
Yeah,
Um,
it's important. You get all
super,
those different phytonutrients, all those different vitamins and minerals. There was one mentor of mine that or she, I'm sorry, she would say, you have to eat 8 different colors a day,
yeah,
which is a lot when you think about it.
it is.
You think like, wow, are there even that many colors to eat?
Most people
But
would do
as
well to start with green.
right, yeah,
It's good.
exactly, yeah,
So we started talking because you have been communicating on the HeartMind Alchemy Project page, uh,
yeah,
contributing, which I really appreciated. Because when we have people that have this deep knowledge and biofeedback, for example, it's really helpful. I mean, it's amazing when they chime in with their knowledge. So I really appreciated that. And I'm
yeah.
assuming.
It's a neat community that you've started. It really is. I like seeing it when it pops up on my feed.
Well, thank you. I very
Yeah,
much. There are so many things that can take our time in different communities. And so I really appreciate that this one feels of value to you. It means
yeah,
a lot to me. Thank you.
yeah,
And it is because of all the people that contribute. There are just a number of really people with a lot of expertise who contribute. And so
totally. Yeah,
very cool that it's such an active community.
it is. It's a cool group.
Yeah, I'm just continually blown away by the wisdom and the new people coming on, sharing graphs and wanting to share about the biofeedback they're doing. And
Yeah,
it's great. It's great to have a forum to contribute and share.
yeah.
So you have something called self-regulation mastery, and I'm just really interested to hear. I know that biofeedback plays a big part. It must play a big part of that. Um,
Yeah,
yeah. So why don't you dive in a little bit on some of this performance self-mastery work that you do?
absolutely. Yeah. Well, it all starts with the nervous system, right? Um, the nervous system is the master controller, right? This guy tells the rest of the body what to do, how to do it. It totally dictates the function of all of our internal organs. And so if this is chaotic, then there's going to be chaos down the rest of the chain, right? And so that's kind of where I start. That's the philosophy, is um, giving the nervous system the respect that it deserves. Um, and there's the autonomic nervous system, 2 parts to it, right? There is that sympathetic, which is what we think of, that traditional fight or flight.
Mhm.
Um, and it kind of bugs me because it always gets talked about as the bear in the woods, right? We have to have that bear in the woods to have our nervous system perceive some sort of life-threatening, immediate, dangerous situation or challenging situation. But most of us don't have those. We don't have those, unless we're in a car accident um, or something like that. We don't have that in our modern society. We don't have those types of life-threatening stressors. But the thing is that our nervous system doesn't know the difference. It doesn't know the difference between bear in the woods and I'm upset with my boss, or I am struggling in this relationship, or whatever it is. I'm stressed out about this. I'm triggered about this. That also is a sympathetic response. That also throws our nervous system into that fight or flight realm. And for example, like let's take a lemon, okay? If you were to, that mind-body connection, if you were to close your eyes and think about cutting into a lemon, and then you cut it up into slices, and then you're getting ready to bring that one slice of lemon to the mouth and bite into it, and you feel that you could already feel the saliva happening in the mouth. Like, how does that happen? It's because we have this mind-body connection. It's It's undeniable. So anyways, so that's where I start. And there's the sympathetic version of that, and then there's the parasympathetics, right? And the parasympathetic is all about recovery and regeneration and repair. The rest and relax part of the nervous system, right? Most folks are operating that sympathetic nervous system. And many of my patients chronically for years and even decades on end. And so just like any other system, organ system of the body, we want the nervous system to be in balance as well. And so when there is that imbalance in the nervous system, we have to start using some tools and techniques to do this balancing act to bring the nervous system back into balance. And so that is what I do with biofeedback and mind-body medicine and what I call self-regulation. I love the word mastery, right? Because that implies a certain skill level. And so that's what I'm super passionate about. But at first, when I'm talking with patients, I can't use that word because they're not interested in mastery. They just want their anxiety to go away. So at the very beginning, it's not about personal growth or personal development as a human being, but over time, then it eventually does become about that. And they understand and they get what it is that we're doing. So it does. It starts to become about being a new way, the nervous system being a new way, and the mastery of that skill level. And that balance of the nervous system, the way that looks is it's not too activated, and it's also not underactivated. You know, it's not, we can't be not doing anything. We can't sit there and do nothing or be so tired, so chronically fatigued. So autonomic balance is when I have that ability to remain poised and calm and focused and in the present moment. And I can take on challenges with ease. So that's what autonomic balance looks like, and that's what self-regulation looks like. But mastery is that next level. It's a different level, mastery of that skill. So that's what I love, and that's what I'm about. And one of the first tools that I use to start to train self-regulation is the breath. When it comes to the nervous system, most folks are overbreathers, right? They're overbreathers, they're chronic hyperventilators. They're often holding their breath, right? Or they're taking in those big deep breaths followed by those large sighs. So frequent sighing, frequent yawning. These are all dysfunctional patterns of breathing. And we can have those dysfunctional patterns of breathing within that 12 to 20 breath a minute range. Within that normal breath rate range, we can still be overbreathers and chronic hyperventilators. And a lot of people don't understand that. And now I still have patients that are overbreath, like they're still clinical chronic hyperventilators where they're 30, even 40 breaths a minute.
Wow.
But we could still be in that overbreathing pattern in that normal breath rate range. And so the first thing that I do is assessing the breath and the patterns of the breath. And the nervous system and the breath are so deeply interconnected. So that's why I start there. And when it comes to the breath and the nervous system, I think that it all starts with the vagus nerve. Okay, it all starts with, well, first, where are we breathing, right? Are we breathing up here with the chest with these accessory muscles of respiration? Because if we are, a lot of these muscles are connected to that sympathetic response. They're already connected to that fight or flight. So if I'm breathing up here, I'm probably taking in more air than I need. I'm probably doing some dysfunctional patterns of breathing. but I'm also engaging sympathetic just because of the innervation of the nervous system. The only muscle that's connected to the parasympathetics is the diaphragm, is that large dome-shaped muscle that sits on top of our abdominal organs, right underneath the rib cage. And so when I breathe into the belly, I activate that vagus nerve. I activate cranial nerve number 10. It starts up here in the brainstem, and it comes down through the neck, and it connects to the heart. It connects to the lungs. It connects directly to the diaphragm. It connects to a lot of our abdominal organs. And in fact, it goes all the way down in the pelvis. So it has this really broad parasympathetic activity. It has this broad rest and regenerate activity in the body. And so that's why it's so powerful. And then the next thing is the breath rate. So stimulating what's called the baroreceptors. Okay, a lot of people, like I said, they're breathing in that 12 to 20 breath a minute range, and many over that. And so the one way that we activate the baroreceptors, which are these pressure sensors, these stress receptors that are in the carotid sinuses, in the aorta, the chambers of the heart. And the one way that we activate those is when we breathe at a very slow rate. Okay, so somewhere between 4.5 to 6.5 breaths a minute. When we breathe at that breath rate, we're going to do two things. One, let's say right now you're breathing at 18 breaths a minute, okay? And we train you for the next 4 weeks, 20 minutes twice a day at 5 breaths a minute. We're going to decrease your baseline, which is 18 breaths a minute, from 18 down to maybe 10 breaths a minute. So now you're in a more parasympathetic range of the nervous system at baseline. Make sense?
Yeah, makes a lot of sense.
The other thing that happens is that when we breathe at that slow rate, we completely inhibit and shut down that sympathetic response. So that's offline. That's complete. That's not even an issue anymore. And so what's left is just the parasympathetics. So we continue to push this pathway over and over and over again, and we're building that strength. We're building that resiliency into the nervous system, and we're making it stronger. And so that's usually where I'll start out in this self-regulation process, is with the breath.
And do you find that's super interesting? Do you find that doing 20 minutes a day, 20 minutes twice a day is enough to cause people to retrain their brains, their system, so that they can then do that same breathing pattern throughout the rest of the day? Is that enough?
Absolutely. Absolutely. Yeah. The research shows 20 minutes twice a day is all it takes to start to rewire the nervous system, to start to rewire the brain into new patterns, into new ways of being. And then absolutely, what you just spoke to was us activating those baroreceptors. If we're activating those baroreceptors on a pretty consistent basis, 20 minutes twice a day, then we're going to start to slow down the breath rate. And then patients are starting to notice that they're just breathing at a slower rate in their abdomen all the time.
Yeah, interesting.
So it's all about training that new neural pathway.
Okay.
And that's, let's go down this road now. So how I
I just want to interject. That's interesting because I always have the sort of Sarah Lazar paper on meditation, 30 minutes a day of meditation, changing the brain so radically into new pathways. So it's interesting to see that actually the breath work that you're talking about too is, well, maybe a little bit more, 20 minutes twice a day, but
totally
to shift the brain that much.
Yeah. Well, and that in itself, the breath work, it very much is a meditation.
Yeah.
It's a meditation on the breath. It's a very mindful type of meditation. Where I was going was I was going to start talking about kind of the breakdown of how I start to work with patients. So a lot of my work, well, first was kind of informed and put together by my mentor, which is Dr. Brad Lichtenstein. He is another doctor, certified in biofeedback, board certified, and a professor at Bastyr University. And yes, he really helped form how I thought about the nervous system and how I thought about patient care. And the one thing that I learned from Brad was using everything, right? In medicine, we get very stuck into one modality or into one way of thinking about something, one way of coming at a problem. And what I learned from Brad was he took from everything. He took from everything, and he made this thing, this mindfulness-based biofeedback thing, that was so unique because it had not just biofeedback and mind-body medicine, but it had cognitive behavioral therapy. It had motivational interviewing. It had acceptance commitment therapy. It had cognitive reframing. So it had Eastern contemplative practices. So all of these things, all of these different modalities and therapies made it into working one-on-one in that therapeutic relationship with the patient. And so that is largely what I do now too, with some tweaks here and there, because my work's definitely also informed by some other experts and colleagues in this area. Dr. Ina Kazan, Dr. Leah Lagos, they're all fantastic physicians in the biofeedback realm. And if anyone's looking for any more information on them, I'm sure they could find it at the AAPB, which is the Association of Applied Psychophysiology and Biofeedback. It's one of the professional organizations that I'm a part of, as well as, like you mentioned earlier, the BCIA, the Biofeedback Certification International Alliance. But so there's all that. There's all that that's rolled into what I call mindfulness-based biofeedback. But within that framework, there's the polyvagal theory. So there's Stephen Porges' polyvagal theory, and that informs how I think about the nervous system. And so the first thing I'm interested in is the stressors. What are the stressors, the fears, the worries, the triggers that activate that person and get them going? I want to be able to understand those so that I can understand how their nervous system is behaving. That makes sense?
Yeah, makes perfect sense.
And then I want to know their stress response. So how do they experience stress? How do they know that they're stressed? Are they, do they immediately dissociate out of this situation? Do they get palpitations? Are they nauseous? Do they start to sweat? Do they hold their breath? All those different things. Then their orientation strategy. How is their nervous system orienting to that stressor or to the moment, to the environment? We think of and so there's three different ones. Mm-hmm. The first one is that traditional fight or flight response, okay, what we call mobilization. And that's mediated via the HPA axis, the hypothalamic pituitary axis, and the adrenal medulla axis. So it gets the epinephrine, the norepinephrine flowing, right? Those stress hormones that get dumped into the blood, and then we actually feel that response, okay? And mobilization is, or what it looks like anyways, is, I've got a plan for the next plan. I've got a contingency for the contingency. I'm an overthinker. I'm a go. And it's not just the body, it's not just the physical body, but it can also be the mind. It can also be that just never being able to shut it off and the mind is wandering. So that's what mobilization kind of looks like. Now, immobilization, in contrast to that, is like this, right? It's very constricted and contracted, and I can't even think about what's going on over there right now. And so I start to dissociate and go off and scroll, endlessly through Facebook or binge watch 10 hours of whatever show on Netflix. And that's all mediated by that fear response, by the amygdala, that the limbic structures of our brain, the more primitive centers of our brain, via the dorsal branch of the vagus nerve. And that is a slower response. That dorsal vagus it's like if someone was going to pass out, like if someone was going to faint, they had that what we call vasovagal syncope. All right, if they're getting their blood drawn, or if they heard some terrible news, right? There's a little bit of a delayed response before they go, right? And the third one, and this is kind of where we want to be. This is a healthy stress response. It's called social engagement. And social engagement is when we feel safe enough to be able to socially engage, to problem solve, right? And that's all informed by our breath, by our posture, by our intonation, how we're actually speaking. So if I'm like this and my head's down and I'm talking like this, and that's sending signals to my nervous system that are much different than if I'm like this and I'm singing, right? That would be way different. I'm sending different signals to the nervous system. And that's all mediated by the nucleus ambiguus, which is via the ventral vagus. And the ventral vagus is the myelinated branch of the vagus. So it's much quicker. That response happens much quicker. But we've got to get the nervous system used to that pattern. We've got to get the nervous system used to that pattern of being, which I'll come back to and we'll talk about here in a moment. Yeah. But the next thing that I'm interested in is the stress families. Okay, so stressors, their stress response, their orientation strategy, and now what stress family do they fall into? Because the stress families is going to indicate what therapy we're going to start with. So when I say stress families, there's 6 different ones, and most people fall into multiple categories. With the stress families, there's stress muscles. So if I'm guarding in a certain way, or if I'm holding myself a certain way, that is stress muscles. I'm creating that low-level tension in the muscle that's going to inform the nervous system that I'm stressed, right? That I'm carrying tension. Mm-hmm. And stress posture is kind of similar. Stress posture is if I'm sitting here all day like this at the computer screen, right? And I'm doing this for 8 hours. I'm sending that signal up to the brain that, hey, I'm stressed. Because the body can tell the brain just as well as the brain can tell the body that we're stressed. They can send the same thing, the mind-body connection, right? Sure. The next thing would be breathing. And most people fall into this category, stress breathing. They have those dysfunctional patterns of breathing. Let me back up a little bit. So for stressed muscles, what we would do as far as therapy would be things like progressive muscle relaxation, as far as the different mind-body techniques that we would train. Stress muscles will be progressive muscle relaxation, or Autogenics. With stress posture, it would be therapeutic exercises, stretches, yoga, things like that. With stress breathing, we're going to obviously train functional breathing, functional, slow-paced diaphragmatic breathing. The next stressed family is stressed attention, okay? And stressed attention is really just the inability to maintain focus in the present moment. Okay, it is that person who is just flighty, right? All over the place. And they can dissociate quickly and easily. For stressed attention, we are training a lot of different mindfulness techniques and mindfulness meditations and things like that. Yeah. For stressed emotions, now stressed emotions is I experience a stressor and now I start to beat myself up, right? I start to get my self-talk becomes very negative. And so for stressed emotions, we're starting to train heart focus practices. So things like heart center meditation or emotional tone breathing, loving kindness meditation, self-compassion, love, gratitude, all those different things. And that always comes a little bit later, because when we turn to ourselves, right, we're always our harshest critic, right? So when we look in the mirror, there's more critiquing instead of gentleness and softness that we might do with a family or a friend, right? So that work can take a little bit longer. And then there's stress body focus. And stress body focus is, I experience a stressor, and now I start to kind of ruminate on one particular part of the body, and it tends to be in the core somewhere. So it's either, oh my God, my heart is racing, and then I start to hyper focus on it, and then it gets worse, right? Or I'm getting nauseous, or my stomach's churning, and I just feel like I'm going to vomit, and then that starts to get worse, and then I actually do vomit. So that's stress body focus. And for stress body focus, we train what's called Autogenics. And Autogenics is a sort of like a self-hypnosis technique, very, very deeply relaxing practice, which we'll talk a little bit more about. And then the next thing that I'm interested in is the hierarchy of values for that person. How does that person live their life? Because those values dictate how we live our lives. And so I'm interested in those values, because if personal growth and development or mastery isn't near the top of that list, then the training is going to take a little bit longer. But when it comes to the polyvagal theory, the first thing that we have to do is create safety. Most people are coming in because something feels unsafe, something is challenging to them, they're struggling with something. And so the way the nervous system is perceiving it is an issue with safety. And that's the amygdala. The amygdala is all about assessing safety in my environment, right? It's about being on guard, being on lookout. And so, and that's with trauma work, what's definitely the first thing we have to do is create that safety and kind of reframe how the nervous system perceives and views that thing.
And what's your primary technique that you go to for that?
It's different. It's different from patient to patient. But I would say probably the bulk of the time, the breathing. The breathing usually tends to be safe enough for a person, and easy enough to where we can start to retrain it to get that breath down into the belly and slow it down enough to, again, shut off the sympathetics and start to bring about that parasympathetic response.
Yeah.
It's the quickest and most effective way for sure, but it doesn't always, breathing for some people, especially if there is trauma sometimes and they start to hyper focus on it, then it starts to get worse.
Yeah.
So yeah, it's different from patient to patient, but I would say breathing is probably more often than not the first thing.
Okay. And do you use heart rate variability training, like HeartMath type of training?
Definitely. Absolutely. I don't use HeartMath so much anymore, though. I use it sometimes with kids. I think it's good training or like for beginners.
Mm-hmm.
But no, it's not something that I use too much clinically anymore.
HeartMath specifically.
But yes,
HRV. Yeah.
Yes, absolutely. Yeah. Oh,
and
yeah.
why is that? I'm just curious. I have a HeartMath device, and it's very simple, but actually, I feel like I really like it, and I can kind of understand, the readout's simple. And although there's these people on the HeartMind Alchemy Project community that are, showing some other devices they're using, like iThrive, and
right.
Yeah. So can you talk a little bit about those more sophisticated tools, why they're useful, what for do-it-yourselfers, like what do you?
Yeah, absolutely. Yeah. So with HRV, when I am training heart rate variability biofeedback, which usually comes if I'm seeing a new patient, like in that third to fourth week, somewhere in there, we're starting to train heart rate variability for two reasons. One, and the reason why I do see some patients is because they're coming in for to decrease their cardiovascular disease risk or to decrease their blood pressure without having to go on medication or do supplementation or things like that. So they want the least invasive, most effective thing that's going to be the least invasive. And heart rate variability is an awesome indicator of true cardiovascular health. And so if we've got high HRV, then it's a pretty safe bet that we've got a pretty optimal cardiovascular system functioning. The other thing is that if we have high HRV and we're training that, we have and this is what the research has shown, we have a very resilient, flexible nervous system. We can take on more challenges and not get activated, not go over to that sympathetic response. Mm-hmm. And so that's what I love about HRV is mm-hmm. that it's really about resiliency training. Mm-hmm. And so that
resiliency training, really, right?
Absolutely, yeah. Absolutely. The stronger that we can make the nervous system, the more resilient that it's going to be. Okay. And so HRV is all about that. Yeah. And it comes back to respiratory sinus arrhythmia. We breathe in, that heart rate goes up. We breathe out, that heart rate goes down. And that's what respiratory sinus arrhythmia is. And the variability is the max peak of heart rate at the top of the inhale and the bottom heart rate, so the lowest heart rate at the bottom of the exhale. And what's the max min between those two? And it's different from group to group. It's different from male to female. It's different in different age groups. So it's such a unique biomarker to that person specifically. And so it's hard to give broad population-based like HRV norms because it really just doesn't work that way.
Can I stop you for a second?
Sure.
Are you saying that, I mean, in heart math, you
yes.
get your HRV score.
Yeah.
Mine this morning for my 5 minutes was like 5.3 or something. Are you saying that it might not always be that, that everybody's going to progress to 7, 8, 9, whatever, that some people are going to have a good heart rate variability for them that's 5 or 6? Is that what you're saying or no? Or is it
sort of, yes. Yeah. So HRV is influenced by so many different things. Okay. And it's all about our autonomic nervous system. Our autonomic nervous system is what dictates HRV. That's why we use it as a biomarker to assess autonomic nervous system function and health.
Okay.
And so when we're using it for performance, let's say, when we're using it with athletes or high functioning business executives or,
drink
or whatever, thanks. All this talking, I'm getting dry. Yeah, when we're working with those people, we're monitoring HRV on a daily basis because we want to know what's changed. And so I like the things that have the tags in them. I like the things that I can put in a workout. I can put in my exercise for the day. I can put in how much water I drank that day. I can put in how much sleep I got. Was it deep sleep? Was it interrupted? What medications am I taking right now? So all of these different things are going to have an effect on the autonomic nervous system. They're going to have an effect on HRV. So that's why I say it's unique to that individual. Now with HeartMath, that's a score. So that's like HeartMath's algorithm to give you some indication of where you're at as far as your heart rate variability. And so there's different metrics when it comes to assessing heart rate variability. The min max is just kind of the most basic one to look at, but there's all these other different indices. There's all these other different metrics And there's the time domain metrics, and there's the frequency domain metrics. Now, when it comes to the frequency domain, what we're trying to do when we're training HRV is we are trying to get into that low breath rate. So that low breath rate, that low frequency, we want it to be very, very high. When we're in that low frequency range, we're stimulating the baroreceptors. We're stimulating the baroreceptors. We're doing the exercise for the nervous system. We're exercising the nervous system if we've got a low frequency that has a very high percentage. So we want low frequency to be 90% or higher when we're actually training HRV breathing, okay? And I'm saying HRV breathing, what I really mean is resonant frequency breathing.
Okay.
Resonant frequency is the breath rate at which I have the highest amount of variability. And the reason that we want to train that breath rate over another one is because when I train at that breath rate, it's like each time that I sit down to do my breathing, I'm doing a super high intensity work. It's like doing a HIIT workout for my autonomic nervous system.
It's optimal for your system.
Exactly. It's unique to you. Yes. So that's resonant frequency breathing.
And you, if I understand from our earlier conversation, you determine that specific metric with your clients.
Yes, absolutely. With everybody. Yeah, we've got to measure that. That's how we're going to get the most out of that breath training, is if we know that optimal rate and we are maximizing the sensitivity basically of those baroreceptors, and we're exercising the nervous system to its maximum potential.
And then once you train on that, then the idea is that you then fall or drop into that during your system learns that you do it then the rest of the day.
Exactly. Not the whole day, but yeah, of course, most of the day, right? If we're just sitting down, like if we're just sitting like we are right now, metabolically, we're not doing anything. We don't need to mobilize any resources. So yes, of course, right here, yeah, I should be in that low breath rate. But if I'm, up and I'm doing more than a walk, I'm getting into some exercise, then yes, then my breath rate should start to increase and I should start to mobilize some more resources. But back to the HRV metrics. High frequency is, okay, this might be a little confusing. So high frequency, if low frequency is the baroreceptor range, okay, the range at which we're activating that parasympathetic nervous system. This is where it kind of gets a little confusing, is that high frequency is technically parasympathetic range of the nervous system. And what I mean by that is if we have a breath rate that is, let's say, 8 to 14 breaths a minute, we're in a higher frequency range, okay? And that higher frequency range, that's okay to be in if our breath pattern is right, all indicating that our breath pattern is right, it has that nice sine wave, then that's okay. That's where we should be at rest, at that lower breath rate range in the parasympathetic realm. So that's high frequency. But when we're training, we want high frequency to be very low because we're training at a very low breath rate, right? Usually six breaths a minute for most people or for most apps or things that people use for HRV. And then there are the time domain measurements, okay? And with the time domain measurements, I think that the two that get used the most are SDNN and ARM-SSD. SDNN is, what that's measuring is the balance between sympathetic and parasympathetic.
Okay.
Now, in 24-hour readings, the research has shown in 24-hour HRV readings that we want SDNN to be above 100. That indicates a good cardiovascular health and resilient nervous system. But in more short-term measurements, so 5 minutes to 20 minutes, the research isn't exactly clear, but it seems like somewhere around 70. We want SDNN to be around. when it comes to RMSSD. And so for example, some measure RMSSD for their readiness readings, right? Or their HRV score for the different wearables or these different programs that people are using. What the research has shown is that the better metric is RMSSD. RMSSD is the best way to think about that is the tone. How strong is the parasympathetic nervous system? How strong is that rest and relax nervous system? So that's what RMSSD indicates.
How does it measure that?
How does it measure that?
Yeah. Like what is it measuring? The strength of the tone. Is it the actual strength of the signal?
No. This is just how the HRV data gets calculated. So these are just different calculations of the HRV data.
Okay.
Got it. So just different calculations, basically.
Okay.
I lost my train of thought for a moment. I was talking about
Sorry
RMSSD.
about that.
That's okay. That's okay.
So these different metrics for HRV.
RMS, yes.
Yeah.
So the good wearables, okay, and the good programs, I think, and the research I think confirms this, is that RMSSD is the better metric when looking at HRV, when looking at readiness of an individual. So some different apps that I use with patients, if they have a polar heart rate strap or something similar, a 2-lead ECG that goes around just below the chest, really around the diaphragm, that is a good measurement, a better measurement than a PPG, a little bit more accurate.
PPG
PPG is a photoplethysmograph. PPG is a heart rate sensor.
Oh, okay.
I've got all this stuff right here. Why don't I just show you? Hang on a second.
Okay. And just to give you a time check, we're almost at 6:30 or 7:30 your time. So
I'm good. My wife is working tonight, so I get to work guilt-free too.
Okay, good.
Okay. This is a polar heart rate strap. And so on the back of it right here, those are the leads.
Okay.
And so this is measuring the electrical activity of the heart. And so that's why it's a really good measurement, because it's actually measuring that electrical activity. This is a PPG, or what we call a BVP sometimes. It's measuring the blood volume pulse. And most people have seen this sensor before.
Yep.
It lights up in there in the red, and this is how we wear that one.
The O2 sensor.
Oxygen saturation, is another thing that can be measured with this.
Yep.
So that's a PPG, and that's measuring the light. So that's kind of measuring the pulse wave of each beat. So with each heartbeat, there's that pulse wave that moves through the vessel. And based on the light that gets reflected back to this sensor, that's how it calculates heart rate and heart rate variability.
I would assume that the HeartMath device, the one that clips on your ear, is doing the same
thing.
So
that's a PPG. Yeah, that's just an ear device. Yeah.
Type of measuring the pulse wave.
Right. Yeah. So there's ones for the ear. There's actually ones for the nose, and then for the extremities. Okay.
Great.
Yeah.
Gosh, we're getting a lesson in HRV. I hope people who have wanted to dive into HRV are appreciating this. Like, sit down with the doctor who knows a ton about HRV. This is so fascinating.
Awesome, great. I would say the one of the apps that I use with patients the most is called Elite HRV. Elite HRV.
I know I have seen some people post on that with Elite HRV.
Elite HRV. Oh, here, I'll just show you can you see that one?
Yep.
That one right there, that's Elite HRV. So Elite HRV gives you, here, I'll pull up the metrics so that we can see it.
So it gives you different metrics than is one of the best that you are sitting here describing. These are the different metrics. These are the most powerful, and this Elite HRV gives you those more powerful metrics.
Yeah, so this was really started, I think, to be used with athletes because it gives you this morning readiness score, okay? And the readiness is indicating where's the balance of the nervous system. Because it should be slightly parasympathetic leaning, right?
Mhm.
Autonomic balance is somewhere in the middle, but it's slightly parasympathetic. And so if the idea that if we have a balanced nervous system, we can function better. We can take on more challenge through the day. So we can exercise even harder, right? But if we've got low HRV, then maybe it's indicating that we are going towards more of an injury state, and we would do well to do some recovery modalities. So some hydrotherapy or a float tank or PEMF or something like that.
Mm-hmm. Are you a fan of hydrotherapy? We and I talked about that a little bit.
Big fan of hydrotherapy. Love hydrotherapy. Contrast is, I think, the best when it comes to getting into that parasympathetic state or getting that balance of the nervous system. Doing a hot and cold therapy, alternating between the two. Maybe 3 or 4 minutes hot and then 30 seconds to a minute cold, and bouncing back and forth about 5 times or so.
Yeah. I'm a huge fan of infrared saunas for detoxification, and I know that's another train we probably don't have time to go down, but are you a fan of saunas and infrared saunas?
I absolutely am, yes. And I think I mentioned to you last time, but it doesn't really matter if it's infrared or far infrared or medium. Just the fact that you are increasing core body temperature and you're sweating. That's what the research shows. The idea between the far infrared is that because it's a different wavelength, it's penetrating the tissues even deeper. Mm-hmm. And so it's mobilizing even more of those fat cells, even more of those toxins stored inside the fat cells. But yeah, we could have a whole conversation about.
We could have a whole conversation
about hydrotherapy.
Yeah.
So this is, let's see. Can you see that there? So this is SDNN.
Okay.
RMSSD, and then there's probably, I can't see it, but there's probably a coefficient of variation. Mm-hmm. There's the natural log RMSSD. There's the mean RR interval. The mean RR interval is the ventricular beat to this ventricular beat, the time between this normal beat and this normal beat. Does that make sense? In milliseconds.
Yeah. Yeah.
So 1,000 milliseconds would be a second between one beat to the next.
Okay. Sure. And it averages across some time period.
Right. It's going to take, yeah, exactly. Yep. HRV-CV, that's that one right there. Coefficient of variation. And that's used a little bit more long-term. Yeah, it's looking at the variation over time, either up or down. So it's measuring it could be parasympathetic leaning or it could be sympathetic leaning.
Okay.
And I think we'll probably use a little bit more research with the coefficient of variation, but the idea there is that if there's too much variation in the variability of the heart rate, then that could also indicate that the nervous system is a little bit more challenged. It's a little bit more taxed. And you would do well to recover. Okay. And then it also gives you at the bottom here, it gives you the frequency domain. So it gives you low frequency power, it gives you high frequency power, it gives you the ratio of the two, and what's the last one? Oh, total power. Yeah.
You're really getting into the number for the geeks here and the biohackers. You really get into the numbers of these different frequencies that you're
That's what I'm interested in.
fluctuating
I'm
at.
interested, yeah, I'm interested in the numbers. I don't really care about a readiness score. I want to see the raw data, because that's what's going to give me the most information about nervous system function.
And can you just unpack that a little bit for the geeks here? Like, what do you do with one of those raw frequency resonance numbers? Like,
Yeah, so it depends. So for example, if we're tracking HRV over time, if we're doing a morning readiness, it's going to change from day to day based on what it is that we're doing. So if yesterday I had 4 drinks, and I didn't get great sleep and I exercised really hard, then my HRV is going to go super low. And so that's why tracking something like a readiness score is nice, because it can help us optimize our performance by knowing when we need to take some time off and fully recover before we jump back into it. Cool. But if we're using it, so with Elite HRV and also with things like Aura, which I'll talk about in a moment, you can input a training session. So you can input a 20-minute breathing session. And so if I'm doing HRV breathing for a 20-minute session, it will record all the data from that session. Now, what I'm looking at during that session is all the data that I just showed you.
yeah.
I want to see RMSSD. And for me, I know that I want RMSSD, because I've been tracking it, right? I know that I want RMSSD to be above 125 milliseconds. I know that I want SDNN to be above 150 milliseconds. I want my mean RR to be greater than 1100 milliseconds. I want my low frequency, and it doesn't give percentage, but you can do the percentage if you quickly do the calculation. I want my low frequency power to be in the 95th percentile or above. I want high frequency to be very, very low. I want that low to high frequency ratio to be very high. I want it to be 12, 15, in that range somewhere. So that's why I say it's unique to that person. It's something you have to track consistently over time. And I think that you get a good assessment of the nervous system if you've been tracking it for about 2 to 3 weeks. Now, these apps will tell you that you can get a good assessment after a few days, but that's absurd.
Yeah. Sounds like the brainwave tracking I've been doing for a year and a half. Like, you learn a lot just watching your brainwaves every day, meditating. Yeah. Same kind of thing. You watch yourself and you get a sense for, what you're, how you progress. And
so it's really about, and we talked a little bit about this, it's really about the somatic experience, that physiological experience that you're having. You're trying to cue yourself into something, to a certain state of being, right?
Yeah, felt experience, right?
Right.
A felt sense.
Yes.
So that like, I now know, even just with my experimentation with heart math, my felt sense of what a higher heart rate variability feels like. Yeah. That's what you're talking about.
Yep, totally. Yeah. And biofeedback works very much the same way, except in my opinion, it's a little bit more concrete, right? When we're utilizing a respiration belt, when we're utilizing the heart rate sensor, when we're utilizing sweat response and temperature response and surface muscle tension, it's all, you can see it right away. It's immediate feedback to you. And so there's less of that kind of feeling into it.
You mean as opposed to brainwave tracking?
Right. Yeah.
Yeah. It takes more time it's a subtle thing, right? Like
it is. It takes a long time.
Right. What does a deep meditation state feel like?
Yes. Yeah.
It's a very subtle thing.
It reminds me of a conference that I attended, and it was biofeedback and neurofeedback specialists, and he was a psychologist and neurofeedback specialist, and he was presenting a case study of a young woman that came in with anxiety and depression that was pretty severe. And he had done something like 120 sessions with her. And he was, going on about how, resilient she is now and this and that. And I'm like, wow, God, yeah. Well, if I had 120 sessions with a patient,
So the
they would
meditation,
certainly be a master.
yeah, totally.
At that point.
The meditation techniques that you teach, are they basic mindfulness breath work? Do you draw on Tibetan traditions, Mahamudra Dzogchen, or Theravada Buddhism, or do you try to Westernize it? What's your approach in the
Yeah,
world?
I try to. So I got to feel out my patients and know which ones that I can do some of the other stuff with, or if I got to keep it a little bit more traditional.
Western
What I
tradition.
mean by, yeah, so more like mindfulness meditation or heart-centered meditation, or the different loving kindness meditation, Autogenics, these different mind-body techniques, right? That is probably the bulk of what I do. And then there's like a 10% cohort of my patients where we can talk a little bit more about energy and colors and chakras and things like that.
C word.
Yep. Yeah. So, but not with everybody. But yes, it always starts with the components of functional breathing. So getting into all those different components of functional breathing, which there are several, but the most important one is effortless. We want that breath to be as effortless as possible. It should feel like if we put our finger right here, we should barely be able to feel that breath moving in and out of the nostrils. That's how effortless and gentle the breath should be. It doesn't require any effort at all.
Oh, that's the first time I've heard that described that way, that it should be effortless. That's beautiful.
Yeah. And a lot of the research is equal on the inhale and the exhale. So 5 seconds in, 5 seconds out.
And why is that? Because I've definitely heard everything from 4 in, 8 out,
right,
4 in, 6 out. Yeah. What?
Well, it's all about the mechanics. It's all about the breathing mechanics. A lot of people do the holding. A lot of people do the over breathing patterns, right? If we're doing those types of over breathing, chronic hyperventilatory patterns, even for 3 minutes, we are changing the nervous system. We're changing how the nervous system works. We're decreasing oxygen up to the brain and to the heart by 30 to 40% after just 3 minutes of doing those dysfunctional breathing patterns.
Dysfunctional, you mean the
holding and
are you talking about like Wim Hof breathing and Soma and these different things like that?
different things. I mean, they can be useful for certain things, but when we're talking about balancing the nervous system, this is functional breathing is the only type of breathing.
Okay.
Yeah.
Interesting.
And
do you do? You were talking about yourself. Yeah.
The breath rate. Yes.
Yeah.
I was going to take it back to the mechanics. Oh, and the blood chemistry. So the blood chemistry, when we are over breathing and we're chronically hyperventilating, we get into those different dysfunctional patterns of breathing. What happens is that the pH of our blood, which is a very narrow range, it really doesn't change all that much. But when we are doing those dysfunctional patterns, what happens is that the pH of the blood, it increases by just a smidge, just a little bit. And that increase in pH of the blood, what happens is now hemoglobin is going to bind oxygen super tightly like this, okay? So I've got plenty of oxygen in my bloodstream, but it's bound to hemoglobin so tightly that now hemoglobin never does this. It never releases it to the different organ tissues of the body. And so because that oxygen never gets released to the organ tissues, now these different organ tissues are starting to send signals up to the brainstem that, hey, we're deprived, we're starved of oxygen, get more oxygen. And so the brainstem then sends that signal down the lungs, and we continue that dysfunctional type of breathing pattern that keeps us more in that sympathetic response. And so with those different patterns, like the holding and things like that, the Wim Hof stuff, that's to create a different physiological experience where it is more sympathetic. You feel that more adrenaline type of experience. It certainly is more energizing.
Yep. And aren't they doing that deliberately, just like he's doing the cold and the hot therapy to
Yeah, exactly.
push your system into these different places,
Yeah,
train it
yes.
to be able to, be in a hypoxic state, for example.
Yeah, yeah. Challenging the different systems of the body to
Yep.
different levels.
Yeah.
Um, but that's not functional. We can't do that all day long. We can only do that a certain amount of time. And when we're doing that, we're engaging the sympathetic nervous system, and we're engaging those stress hormones,
Yeah.
the adrenaline, the noradrenaline, and that's why we feel good. That's why we feel more energetic.
Okay. Okay. So it
But
has its place.
it has its place, but this is more what we're talking about is about balancing
Okay.
the system, autonomic balance.
Okay.
So the effortlessness is the most important part of that.
Okay.
And the research is equal on the inhale, equal on the exhale. But what some of the research indicates, and what I train my patients to do, and I think it makes sense physiologically, is to go a little bit longer on the exhale. When we go just a little, a half second or a second, a little bit longer on that exhale, we're engaging that vagus nerve just a little bit more, because it's on the exhale is when we stimulate that vagus nerve. And we're
Yeah.
stimulating the vagus, we're stimulating the parasympathetic. So we get just a little bit of an extension of stimulating that parasympathetic if we do a little bit more on the exhale.
And the research supports, you said, this sort of more even 6-6, but a little on the
Right.
exhale. But do you think that the 4-8, for example, could be good? It's just that the research isn't there yet to bear it out, or do you see your hunch that,
I don't know. It doesn't, it probably wouldn't match up with HRV breathing. So if you were doing 4 and 8,
Mhm.
you wouldn't get into that level of cardiac coherence, right? And that cardiac coherence is when, more than, several systems are oscillating at the same frequency. And so with cardiac coherence, it's the heart rate and the breath rate. When the heart rate and the breath rate get into that sine wave,
Mhm.
into that nice, perfect sine wave that's balanced, that looks the exact same every single time, then we've got good HRV. We're exercising the nervous system. We've got a very balanced, resilient nervous system. We start to do something that's double. Our heart's not gonna just go up for 4 seconds and then on the exhale for 8 seconds. Our heart's not going to do that for 8 seconds where it continuously goes down. It seems too much. Does that
Yeah,
make sense?
it does. I've been doing some HRV training that way, and I can generate a sine rhythm, but it's,
You can generate a sine rhythm with 4 and 8.
Mhm.
Wow, that's cool.
Yeah.
So yeah, that just goes to show how unique everybody is.
Yeah.
That's
People are
awesome.
very unique.
Yeah.
Um,
Let
so
me finish my some of the different apps. So there's
yeah,
Elite
great.
HRV.
Okay.
There's HRV for training, which is also really good. And then
Okay.
there's one that is, well, it's supposed to be coming out soon. Honestly, it was supposed to come out a while ago. It's called Kubios.
Okay.
Kubios is the premier biofeedback software that's used by all the researchers in the area, and a lot of clinicians in the area to get really, really good HRV data. So Kubios, Kubios.
KUB, I'll put that in the show notes. It sounds like we're waiting for that to come out.
We're waiting for that one. Yeah,
Okay.
I'm excited about that one when it does come out. And then for the different wearables, like I said, I think that getting a polar heart rate strap
Hmm.
and measuring HRV that way on a daily basis
Okay.
is good. It's a cheaper option than some of the other wearables. But to do that, it takes consistency, and
Okay.
it takes same thing every morning. So right when you get up, you do the exact same thing. If you're right in bed and you reach
Yeah.
for the polar heart rate strap, then that's when you do it. Or if you get out of bed and go to the bathroom,
Okay.
and then come back and sit down, and you're
Okay.
sitting down to do it, then you're always doing it that way.
Okay. So do it the same exact way
The
each day.
same exact way every single time. There's got to be that consistency.
Okay.
Otherwise, there's too many variables.
Okay. And
Now, when
then
it
the
comes,
evening too? Do you do an evening session?
no, you don't need to do an evening set. That's just for readiness. Yeah, that's
Oh,
just
okay.
for readiness score. Readiness score is usually somewhere between 3 to 5 minutes. So
Okay.
it's just a snapshot in time of the nervous system at
Okay.
its most rested state. So that's why it's usually right when you wake up.
Okay.
And then for the other wearables, there's things like Aura. So
The
I'm sure
Oura
many
ring.
people are familiar with the Aura ring. Aura is probably my favorite wearable, I think.
Oh, interesting.
It tracks HRV the best, I think,
Okay.
because it has every 5 minutes throughout your whole night's sleep, it's doing a measurement. And then it takes the mean average of all of those and gives you your HRV score for the morning.
Okay.
Now, contrast that to Whoop, which Whoop is a little bit different. We can't really compare the two because they're measuring different things. Whoop is certainly more of a performance type of wearable where it's measuring strain and things like that.
Okay.
But Whoop is only measuring HRV the last 5 minutes of sleep before you wake up.
Oh, interesting. That's really different.
It's really different. It's really different. It's a different measurement.
Yeah.
And so that's why I think Aura might be a little bit more accurate.
Okay.
Certainly the best one for sleep, for measuring sleep and sleep stages. I love Aura, and I use Aura Teams with patients. So Aura Teams and HRV, Elite HRV Teams
Okay.
are probably the two that I use most with patients when tracking HRV on a consistent basis, or just recovery in general. That's why we use most of these wearables, to
Okay.
just measure recovery of the nervous system, right? BioStrap is my fit. So, or a ring is a ring, but then the BioStrap is a wrist wearable. And I don't have mine on, but the BioStrap for me has the most amount of data and tracks everything that Aura does and even a little bit more. You can kind of upgrade BioStrap and it can do some more things that's pretty neat, I think. So the BioStrap's a good one. The ultimate in wearables right now, and this is totally different because these things, Aura, BioStrap, Whoop, they are you have to input data, right? You have to input your exercise. You got to input a lot of different things, and you got to use tags and things like that. But it's measuring recovery at night, right? It's measuring sleep stages. It's measuring HRV, temperature, things like that. The BioBeat is a watch
Okay.
that's made by a company in Israel, and it is continuous monitoring. So
Wow.
continuous throughout the day of not only HRV, but all of these different cardiac metrics. And the way that it started to get used, or I guess the way that they were marketing it, is for vitals. For when patient comes into the ER, they just throw a watch on them instead of hooking them up to everything, because that's what it measures. It
Yeah.
measures everything, but it's expensive. It's $1,200 for the app, or I'm sorry, for the watch, and then I forget what it is for their cloud service, but it's expensive. It's not for everyone.
Yeah. No, that's a little expensive, but
It's different.
yeah.
It's different. It's continuous monitoring, so it's different.
Yeah. Though that's really interesting to hear. All you
Yeah.
describe the different tools.
And then as far as breathing apps,
Yeah.
so for apps to keep you on pace with your breathing, okay? If you're doing 5 seconds in, 5 seconds out, or whatever it is that you're doing. The different paced breathing apps that I like to use for and they're different from Android to Apple. But Apple would be Breathe Plus, so breathe and a plus sign. Awesome Breathing is another one. For Android, there's Paced Breathing, and then just an app that's called Breathe. And they're all unique in their own way, but they are fantastic, I think, in what they do and helping you follow along and keeping pace. So yeah, so those are the different apps that I would recommend. And it is a little bit about feeling into the breath, getting that somatic awareness of the breath, and then that progression of training the breath rate and training that slow, effortless breathing. You're starting out and you're using a pacer. And when I'm doing it with patients here on the screen in front of me, we're just starting out with a pacer where they can't see their breath at all. So it's just a pacer. And then we put their breath right alongside the pacer so that they can see how they're doing versus the pacer. And then once they get the breath rate down and they get the pattern, that new breath pattern down, then we go to no pacer at all. Can they recreate that breath based on the feel of it, doing that same pattern and doing that same rate? So that's kind of the progression of training functional breathing. And it's important to train it throughout the day, all day long, right? I'm getting up, I'm showering, I challenge myself, can I maintain focused awareness on the breath without letting my mind wander, and get into that breath rate? Yep. And then I'm brushing my teeth, and then I'm cooking breakfast, and then so throughout the whole day, just bringing that awareness to the breath. And the more and more that you do that, the easier that the breath becomes. You're just breathing that way automatically. You have changed that pattern of the nervous system. And that's how it goes too with, someone that comes in with the stressed emotions or the stressed attention. That's how the nervous system works, is it gets into those patterns of being, right? Yeah. Yeah. And it lays down that neural pathway. It lays down that neural track. And then over time, as we continue to go back to that, it gets bigger and stronger and stronger. And now all of a sudden, it's this 12-lane highway where this communication can flow so easily. And it's effortless. We don't even have to think about it. It's just automated. It's an automated, hardwired response of the nervous system to go there. Right. And so we can do it without even thinking about it. Yeah. Yeah. And so rewiring the brain, rewiring the nervous system to be a new way takes us reframing, starting a new pattern. So that's like this now, and then making it stronger. And we make it stronger by practice. And so that's what I have to continue to preach to my patients is practice, 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 practice. The more that we're practicing new patterns, whether it's a new breath pattern or a new thought pattern, a new behavioral pattern, a new emotional pattern, the more that we practice it, the more that we're going to grow this new neural pathway, this new neural track, and we're going to make it stronger and more resilient. And then this old one that's over here, this old one is slowly going to start to atrophy. And because we're not using it as much. And so we're forgetting about it. Right. And so it becomes non-issue anymore, right? It's like if I didn't raise my arm for 10 years, my nervous system would have such a hard time figuring out, how do I raise my arm above my head? Because I haven't used those neurons for so long, right? And so it's very much that if you don't use it, you lose it type of thing. Yeah. But we think about that when it comes to the musculoskeletal system. But it's more so the nervous system. If we're not using the nerves and those neurons, we lose it.
Yeah, use it or lose it.
Yeah,
it totally makes sense.
But it's about the nervous system, not about the musculoskeletal system.
Exactly. But I think that the key is to practice it all the time. And that can be hard when you're a busy mom and you're, chasing your kids, or you're in a stressed job. And it's hard to do.
And that's where the mindfulness training comes in. Yep. That's where that's where assessing those patterns is key. And mindfulness is simply just that awareness of the present moment without, and this is the big part here, without any judgment or elaboration on top of it. Because what do? We see something or we have an experience, and then we immediately are creating some story, right? We create some narrative maybe, or we're judging it. We're starting to whatever it is, right? And so that mindfulness is that awareness of the present moment without adding any of that extra stuff, which is very, very difficult at first. It's a new skill that we have to train. And so it's just all about recognizing the patterns, recognizing the breathing pattern, recognizing the thought patterns, the behavioral patterns, the emotional patterns. And there's that progression of training those things. There is the, okay, it already happened, and now I'm aware of it, right? It already happened, and now, oh, okay, I saw what I did. I got back into that old pattern again. I blew up and I did that, right? And then there is the noticing it in the moment. So now I've trained that skill enough to where I'm in the middle of it. It's happening. I'm getting activated. And now I say, okay, no. I know what's happening. I'm starting to get back into that old pattern, that old way of being, because I am perceiving some challenge or threat, but that's not true. And then shift and then reframe and be a new way, right? Pull ourselves out of it in the moment. And then the final step of mindfulness is that if this is the point where I get activated, it's right here. It's cueing in to whatever it is, whether it's something that I feel or something that I am consciously become aware of in this moment, right before it happens. So what can I cue into here before I get activated? And so that's kind of the final stage, so to speak, of mindfulness.
Yeah. To me, there's a lot about, I agree with all of what you said. And there's an art to just becoming a curious observer to your life, to the life around you.
Totally.
Cultivating this aspect of, this is interesting what's going on, and creating some distance.
Right.
So that you're not so fused.
Yes.
Your mind isn't so fused to thoughts and emotions, which this curiosity.
Yes, big time. I love that word so much. I use it all the time. We're just not curious enough.
Yeah. Well, I know
that's what it comes down to.
I know. I'm mindful of time. And so I just want to ask you, I know that you have a peak performance program you're cultivating. Do you want to quickly just say a few words about that? And you had this special offer for people that are watching, which is...
Yes. Thank you. I am in the middle of creating a peak performance online program that I'm really, really excited about. And so I wanted to offer a significant discount to everyone in this group who's interested in peak performance. And it'll really talk about a lot of the things that we talked about today, but on a much deeper level, of course. So it'll start with the foundations, everything that we talked about at the beginning, as far as the foundations of health. And then it'll get into the mind-body techniques and the biofeedback, and talking about HRV and recovery, a lot about sleep, talking about the different wearables and what I use, and then training the resonant frequency. So using some sort of tool, whether it's an iFeel sensor with a live software, or a GP4 amp with some respiration and heart rate sensor. So yes, I just wanted to offer that to everyone in the group when it does come out, which will hopefully be sometime in October.
Okay. Okay.
And if folks here are interested at all, if they have questions or if they're interested in working with me, they can contact me via my website at ACEO Natural Medicine. It's ACESO naturalmedicine.com. And that would probably be the best way to get in touch with me.
Excellent. And we'll be sure to put that in the show notes too, the link
Great.
to how people can get a hold of you. So
Great. I want to talk about books too.
yeah, okay. So the last thing, yeah, let's hear it. I totally want to hear your favorite books in this realm. There's so many
Yes.
good ones. So I'm very curious to hear your favorite.
Yeah, there's a ton. So when it comes to meditation, and I don't know if I really answered your question earlier. So for my own meditations, I do a lot of those different techniques. I love Autogenics. I use Autogenics a lot. But TM, I do TM a lot, so Transcendental Meditation. But my favorite book of all time is Autobiography of a Yogi. I assume you're familiar.
Yes.
Yeah? Okay. Many people in this group, I'm sure, are familiar, but that is by far
many Kriya practitioners.
Yeah, that is by far my favorite book. And then one that I've been reading for actually several years now, and it was because I was told that you can't take in too much knowledge at one time, is Yoga Vashishta of Valmiki. Are you familiar at all with this?
That one I am not familiar with.
So this is the story about Rama and how kind of his path, his journey started in meditation and all of his mentors and gurus and everything. So it's super fascinating. It's filled, I still haven't finished it. It's filled with knowledge and wisdom. And so I don't know if I'm saying it right. It's if people out there are looking to try it out, it's Yoga Vashishta of Valmiki, Valmiki. Oh, I can't hear you. Are you muted?
I'm muted
There you
because
go.
I had some kids walking around upstairs.
Okay.
Sounds like that one struck a real chord with you.
Yes, yeah, big time. I would love it if others commented on this video. What are you guys reading right now? I love knowledge. I love books. I love reading. So yeah, if there's something good that people out there reading, share it with us.
Yeah, please do. Please do. I'm doing deep dives right now into Mahamudra. So reading books like Pointing Out the Great Way by Dan Brown and
Cool.
and other kind of Mahamudra texts that are coming.
Awesome.
There's so much to read and not enough time.
Yeah. Yep, definitely. I agree with you on that.
And then there's practice, which, you can read about it all you want, but at the end of the day, you actually just need to sit down and practice.
Yes, yeah. Practice is the most important thing. Putting it into action, putting it all into action. We got to take steps. As long as we're taking some steps every day, we are moving in the right direction as far as personal growth, personal development.
Yeah, I couldn't agree more. So, it's been such a pleasure to have you on, Dr. Smith. Thank you very much.
Yes, absolutely.
All your wisdom and your sort of deep dives in some of the HRV biohacking. It's fascinating. So just really appreciate it. And I know people in this community, because there's a lot of folks who track HRV. So I feel like there'll be a lot of people with whom this information will be very interesting. And also to hear about your biohacking tools, some that your favorites.
Yeah. Yes, there was so much to talk about. I feel like we didn't we just scratched the surface.
Yeah, an hour and 40 minutes later, and we skimmed the surface. So we'll have to have you back on to
yes, yeah, wonderful. I would love to.
Great. Yeah, maybe when you start your peak performance program, you can come back on and talk about it.
Cool. Yeah, that sounds great.
Okay. And yeah, definitely let folks know too on the community when that's available.
I will. Yes, thank you. Thank you.
Well, thank you everybody for tuning in. Just really appreciate all the support for these interviews that I've been doing, and the reactions. It's been really wonderful. And I really appreciate it, and just send lots of love and blessings to everyone out there, and to you for your time. Thank you so much.
Yes, thank you very much. And I just want to echo what you said. And this is awesome community.
Yeah. All right. Well, thank you. Be well, everybody. Have a good night.